Investigate effective strategies for managing chronic wounds, including pressure ulcers, diabetic foot ulcers, and venous leg ulcers. Detailed study, chronic wounds, including pressure ulcers, diabetic foot ulcers, and venous leg ulcers, present significant challenges in healthcare due to their complex etiology and prolonged healing processes. This abstract delves into the strategies employed in managing chronic wounds, focusing on evidence-based practices and innovative interventions aimed at promoting effective wound healing and preventing complications. The abstract begins by highlighting the prevalence and impact of chronic wounds on patients' quality of life and healthcare systems, emphasizing the need for comprehensive and multidisciplinary approaches to wound management. It discusses the importance of early assessment and diagnosis, identifying underlying causes and risk factors, and tailoring treatment plans to individual patient needs. Key components of chronic wound management include wound debridement, infection control, moisture balance, and wound bed preparation. Advanced wound dressings, such as hydrogels, foams, and alginates, play a crucial role in creating optimal wound healing environments and facilitating tissue regeneration. Furthermore, the abstract explores emerging technologies and therapies, such as negative pressure wound therapy, NPWT, bioengineered skin substitutes, and hyperbaric oxygen therapy, which show promise in accelerating wound healing and improving patient outcomes. By synthesizing current evidence and best practices in chronic wound management, this abstract aims to inform healthcare professionals, policymakers, and researchers about the latest advancements and strategies for addressing the complex challenges associated with chronic wounds. It underscores the importance of a holistic and patient-centered approach to wound care, emphasizing the need for ongoing education, collaboration, and innovation in this critical area of healthcare. Here are 3 objectives related to chronic wound management strategies. Objective 1. To review current evidence-based practices, conduct a comprehensive review of current literature and guidelines on chronic wound management, focusing on evidence-based practices in assessment, treatment, and prevention strategies for pressure ulcers, diabetic foot ulcers, and venous leg ulcers. Objective 2. To evaluate the efficacy of advanced wound therapies, assess the efficacy and cost-effectiveness of advanced wound dressings, therapeutic modalities, such as negative pressure wound therapy and hyperbaric oxygen therapy, and bioengineered skin substitutes in promoting wound healing and preventing complications associated with chronic wounds. Objective 3. To explore multidisciplinary approaches to wound care, investigate the role of multidisciplinary teams, including wound care specialists, nurses, surgeons, and allied health professionals, in providing comprehensive and integrated care for patients with chronic wounds. Evaluate the impact of collaborative care models on patient outcomes, quality of life, and healthcare resource utilization.